Hey everybody, my name is Faith Jamil and I'm a registered nurse, and my main background is med surg and recently cosmetic nursing. And I'm a fellow board member with the Chaldean American Association for Health Professionals. And I'm here today with other board members, Dr. Rena Deza and Mr. Ronnie Fumia. How are you?
Good to be with you, Faith and Ronnie.
Yeah,
Dr.
thank you.
Rena is a primary care physician, and she's a part of the Henry Ford Health System. And Mr. Fumia, or Ronnie, aka Ronnie, big man, is the area director of pharmacy with Ascension Health. And we just wanted to speak with you guys about COVID and how it's hit our community very hard. And I just wanted to start off with some questions. What can we do moving forward to prevent more cases?
Yeah, very important and great question. I guess I'll start. I just want to start by saying how much I love how family oriented our community is, how much we love our gatherings, how holidays are so important to us. But I think a lot of these gatherings have contributed to the increased number of cases that we're seeing all over the states in Michigan and sadly within our community. Now, I know so many people are masking up when they leave their household as they should and trying to physical distance. And anyone who knows me knows that I have such a close relationship with my grandmother, my 88-year-old grandmother, and I haven't been able to see her myself. Super hard for me. Christmas is coming up, but it's just a small sacrifice, something that we've got to do. And I just want to remind people, please, the Christmas holiday is a big one for us in the Chaldean community. Stay within your household. If you have to leave your house, please mask up. Keep washing your hands. Let us protect our elderly and the rest of our community members. It's our duty.
Yeah, I would agree as well with Dr. Deza. I think too is about really making sure that we all work together. There is light at the end of the tunnel of this. So the sacrifices that we make right now are going to be small compared to the benefits later on. There are a lot of people that are ignoring the guidelines that are out there. As Dr. Deza said, the gatherings are a big issue. Too many people are thinking about themselves. It's not about our younger generation necessarily contracting COVID. It's about when they take it home to their grandparents and their parents as well that are higher risk. So it's not just, we all have to do our part to make sure that we limit the spread of this. But as I said, that we'll talk about soon, there's light at the end of the tunnel with this.
Okay. Just going over the mask, can you address that real quick? A lot of people think that the mask doesn't work or they don't even wear it appropriately. You walk around and you see people like the mask is like falling down. Can you go over that real quick and why it's important?
Absolutely. So remember that this virus is a respiratory virus. So the main mode of transmission is from person to person. And so by wearing that mask and covering your nose and your mouth appropriately, you are mainly protecting the other person from you, but also some small protection from yourself as well. Remember, it's not just coughing and sneezing that can spread the virus. It's even just having a conversation with someone. So having that mask over your nose and over your mouth, covering the entire area, super important. Having it below your nose is not helping. So over mouth and over the nose.
Okay. And what would I do if I think that I had some sort of exposure to the virus? What's the protocol?
Yeah, that's a really important question. I think at first we should define what an exposure actually is. So, we just finished talking about masking and that the mode of transmission mainly is from person to person. So if you are around somebody who has known COVID-19 for at least 15 minutes, that's an exposure. Any sort of sharing of utensils, whether it's food or drink utensils, kissing or hugging, any of that is considered an exposure. Now, what would you do? The CDC has changed the recommendations on quarantining a little bit. So if you do get a test and it's negative, then you would quarantine for 7 days. If you choose not to get a test, you should still quarantine after that exposure, but the time is a little bit longer and it's going to be 10 days. So depending on if you get a test or not, those are the guidelines.
Okay, and where could I go to get tested? And which test is better, the rapid or the PCR?
Yeah, great question, Faith. So that's a very common question. So there's two really common tests that are out there. The first test is a antigen test, which a lot of people refer to as the rapid test. You can get results back as quickly as 15 minutes with this test, but there are downsides to it where it may not be as accurate as the more common gold standard test, which is called the PCR test. Even though the rapid test, you can get results back within 15 minutes. Again, the concern with it is it may not be as accurate. The PCR test can take a day to 2 days to 3 days to get back, but that one is, as I said, considered the gold standard of the two tests. The question that comes up is, where do you go? This comes up all the time. Where do I go for testing? Well, there's a lot of resources that are available out there. First of all, if you go to michigan.gov/coronavirus, there's actually a link to put in your zip code that'll give you information on testing sites around you. But not only testing sites, but free testing sites that will point you in the right direction. A lot of the chain pharmacies are also offering free testing. If you go to CVS.com, if you go to Walgreens.com, if you go to RiteAid.com, they also will offer, by putting in your zip code, a lot of those places offer testing by appointment. Now, be aware, there's also places where you go and you may have to pay for the test, but it's also considered an office visit. So ask the right questions. Maybe talk to your insurance to see what is covered and what is not. The point is this: there's a lot of places to go to get tested, and not only tested, but tested for free. People just need the resources on finding out where to go.
Yeah, and I think that prevents people from going, especially if they paid 151 time and then again, and they're like, oh, I keep paying and I'm negative every time. So that website would be good resource to go to. So, Dr. Deza, is there light at the end of the tunnel? Like, how much longer can we live like this? Can you talk to me a little bit about the vaccine that's coming out?
Yeah, absolutely. You hit the nail on the head. That the vaccine is our light at the end of the tunnel. I know that Ronnie mentioned that light earlier. So the vaccine is really our way out of this. It's the way for us to achieve herd immunity. It's the way for us to get back to some normalcy, hopefully in 2021. So I know through the news, a lot of people are hearing the names Moderna and Pfizer, and those are the two major companies that are hopefully going to get it approved in the next couple of weeks by the CDC and by the FDA. And both of them have what we call mRNA vaccinations. It's a two-part series. You'd get one now, let's say, and then the second one would be in about 3 to 4 weeks, depending on which company you go through. And you must get both vaccines in order to achieve immunity. So that's really important. And how does it work? So mRNA, messenger RNA, is what they're going to be giving us. And just to let you guys know, for example, I'm right-handed, so I would get my shot in my left shoulder to elicit an immune response. So we get this response of antibodies and T cells, and hopefully they stay in our memory. And once we come in contact with the coronavirus, or if we come in contact with the coronavirus, then our body is ready with those fighter cells to fight off the virus. I really want people to have confidence in the vaccine. I know I get concerns. Faith, you and I have talked about this many times about how, people are worried about it. It was done so quickly, and why should I trust it? And it's only, 11 months, and usually vaccines I read take years. But so far, the data and what we know is very promising. People, unprecedented times, and the vaccine is no different. The whole world came together to work on this vaccine, which has never happened before. The most brilliant minds all over the world. We had record numbers of people who signed up to be part of the study. And that's usually what takes a long time as well, getting people to sign up to come into the study, the logistics, getting their information, waiting for people to contract the virus so we can follow them. But we're in the middle of a pandemic, so many people have contracted this virus, which made it easier and quicker for us to gather data. So again, please have faith in it. I'm going to get it myself. I'm going to have my elderly grandmother, my mother, my family members. So hopefully that says something.
Yeah, I agree with you wholeheartedly. When vaccine becomes available for me, I'm going to get the vaccine. When vaccine becomes available for my mom, I will make sure that she gets the vaccine. There's a lot of information out there. There's a lot of good information and there's a lot of bad information. And I agree wholeheartedly with Dr. Deza. Here's why. Because the overall data right now is so encouraging. If you really think about it, we have 2 main vaccines and a third that's coming up right now. We have Pfizer's vaccine and we have Moderna's vaccine. Both of them in the trial so far have shown to be 90% effective. Here's the thing that blows people away, though, that people need to know. Not one person that has been in the trials from these vaccines has died from COVID. That is very encouraging results. So, but if you think about it, you hear a lot of this stuff about, well, it's a new vaccine, I'm scared to take it. The process that we've gone through, even though it's shorter, yes, we haven't been studying these for years and years, but the initial data, we didn't skip any steps. The clinical trial still went through phase 1, phase 2, and phase 3 in a condensed format. And that during those trials shows if a vaccine is safe and effective. The majority of the side effects that people have experienced so far are in the trials. And again, we're going to learn more as we go, have shown pain at the injection sites and swelling, some muscle pain, joint pain, fatigue, a low-grade fever. Those have been the majority of things that happen. Now, let me remind you, these are not necessarily unusual to other vaccines. We see these with other vaccines as well. And I remind people, not one person that has received the vaccine in trials has died. When you look at what's happening in society today, no one can talk about it more than Dr. Deza. She sees it every day about the number of people that are suffering in the hospitals, number of people that are dying. And it is our duty to make sure that we get this information out there. I will line up. I'm going to line up my mom to make sure she gets it. Keep this in mind. It's also being rolled out in a phased approach. There's going to be phase 1A, 1B, 1C, and phase 2. Phase 1A is going to be to make sure that healthcare workers get the vaccine first, along with all seniors in long-term care facilities. That's going to be phase 1A. Phase 1B is going to be essential workers, people like our police and firefighters and our teachers. Think about how important that is. We see it every day about parents saying they want their kids back in school. Think about how important it is to protect our essential workers, such as our teachers and police. That's going to be in phase 1B. Phase 1C is then going to be our senior population, people over 65 years of age and over, and then also adults that are high risk. That's going to be phase 1C. And then phase 2 will be the general population. So think about this. We've gone through 3 phases of clinical trials. We've gotten a ton of information about safety and efficacy. By the time the vaccine reaches the general population, we will have more data by then and ongoing information. So this is just the start, and that's very, very important.
What about the people that have already had COVID? They're like, I don't need the vaccine. I've already had it recently. I have the antibodies that, as we all know, are not going to last a lifetime. Can you go over that, why it's important for them to receive it also?
Yeah, well, you said it, Faith, that we don't know how long that immunity lasts. So the short answer to your question is yes, please, when it is your turn to get in line during whatever phase that is appropriate for you, please do so. We don't know how long that immunity has lasted, and there have been a few cases of reinfection as well. So please protect yourself when it is your time.
Okay.
Yeah, and I was on a call this morning with the state of Michigan, and our top doctor, Dr. Khaldun in Michigan, was talking about the vaccine and what the goals are for Michigan. The goal by the end of 2021 for us to really try to bring back the normal lives that we had before was to reach 65 to 70% of the population to be vaccinated. That's what it's going to take. But if you look at it, it's going to start with us. It's going to start with making sure that the information is out there, that people know that the vaccines are safe and effective. Because if people are hearing rumors out there that this is not something that they want to do, we will never get back to the life that we had prior to COVID.
Agree.
I think one of the things that I often hear is I'm not taking that vaccine. The CDC says that the survival rate for COVID is 99%. Why not just go with the herd immunity route? Can you both go over that? Either
I
one.
really hate hearing that statistic because it takes away from, we have over 280,000 deaths in the United States right now. We're having 200,000 cases of COVID every single day. Now, even people, and Ronnie mentioned, that I see these patients all the time. I've seen mild, moderate, severe patients. And even my patients who are mild, who have recovered, so many of them who were healthy still suffer from so many different complications. Young people who have no other comorbidities. I mean, I'm not just talking about, maybe someone has underlying asthma. I'm talking about, even something as I still can't taste and it's been 4 months.
Mhm.
I mean, that's still something that lingers, and it's still a nasty virus. I mean, I gave the statistics on the deaths, but it's not just about surviving. This is a nasty bug, and we need to do everything we can to try to eradicate it. Vaccination is the only way. But before the vaccine comes, continuing the physical distance, masking up, we don't want to contract this virus.
Yeah, I agree. And if you look at it, I find that infuriates me when I hear people talking about that. Well, it's just like the flu, and they'll compare it to other things. If you look at how many people are developing infection every day in this country, whether it be 100,000 or 200,000 people that are getting infected every single day, that 98% or 99%, or when there's 2% of that, that is massive numbers of people that are suffering and dying. You see it all the time. You see 2,000 to 3,000 people dying every day. So no, we have to change that thinking and mentality around that. Here's the other thing that I see within our community as well. Well, I had it. I didn't have many major issues. I don't know what they're talking about. They're just blowing it out of proportion. That is so not the right way of looking at it, because of the fact there are people that are suffering. There are our elderly population, right? Our population that's going to church every day, for example. I fear my mom every single time she goes to church. I worry about her. And to me, the hope is bright. If we, once I get her vaccinated, I will feel so much better. And so will other people. But we have to change that thinking around it's no big deal. It is a big deal.
Ask you both about is mental health. I'm sure, Dr. Rena, you're seeing more mental health issues within the hospital. And Ronnie, you're probably noticing an increase in those antidepressants, anti-anxiety medications. Can you both go over that? It is a hard time. Maybe you can give us some pointers on how to cope.
Yeah, it is a very hard time, not just with the pandemic. I know that so many people have lost their jobs, and I see it every day in my clinic. I see it with family members. I see it in myself some days. I mean, these are really tough days. So simple things you can do. First and foremost, please take care of yourself. Check on your loved ones. Notice little changes in behavior in your friends and in your family, and reach out to them. I mentioned earlier that I don't get to see my grandma as much as I used to before the pandemic, but I call her every day. Are you okay? Yes. And she asks me how I'm doing. It's very small, simple things you can do to reach out to one another to stay connected. Sleeping is huge, making sure that you're getting plenty of sleep, eating well, exercising, drinking plenty of water. These are simple things that you can do to boost your immune system, but also elevate your mood. I think we all need it for these times. And don't hesitate if you're doing these things and they're not working for you, or if you're noticing some concerning behavior in family and friends, bring them to see me, bring them to see their primary care doctor. That's why we're here. We are here to help. We're here for you, not only to educate, but to help as well.
Yeah, I agree wholeheartedly. And these sacrifices that we're asking for people to make right now are short term. We keep repeating this, that there's light at the end of the tunnel. There's hope that's coming up, happening, then you're not human. It is. I agree with Dr. Deza 100%. Let's check on each other. Let's check on our elderly. I can't tell you how tough it's been on people that are isolated. I truly believe that mental health issues are extremely important now. More people are overdosing. We're seeing suicides happening. It is real. And just because somebody has a smile on their face doesn't mean that they're not going through a tough time. So having those conversations and looking after our family and friends is absolutely crucial. But I keep coming back to this point. We're there. We're not far off to getting back to what we had and living a normal life. But people just have to be disciplined. That's all we're asking people to do, is be disciplined right now. Social distance, wash your hands, be smart, wear a mask. And if you're not feeling well, don't just assume you have the cold. Stay away. That's so important. But the key thing is short term, because light is available at the end of the tunnel.
Thank you both very much for answering these questions. And if you have any questions, anyone out there listening, please feel free to reach out to any of us.
Awesome. Thank you so much, Faith.
Good to see you guys.
Yeah, thanks, Dr. Ordeza. Appreciate it.
Thank you.
Thanks, guys.